Welcome everyone to our Week 4 lecture. We'll be reviewing the nervous system and its general components, followed by a closer look at the sensory system. Here is the nervous system. Here are your objectives. They're the same ones you have in Connect. The nervous system directs all human body systems, controlling both voluntary and involuntary actions of the body. The primary cell of the nervous system is the neuron, and we have about 100 billion of these nerve cells on average. The nervous system is composed of two main divisions, the central nervous system and the peripheral nervous system. The central nervous system consists of the brain and the spinal cord, whereas the peripheral nervous system is composed of the nerves that branch out of the brain and spinal cord, connecting the brain and the spinal cord to the rest of the body. Here you can see what a typical neuron looks like. Each neuron is an electrically excitable cell with components that allow them to send and receive signals in milliseconds. The dendrites of a neuron receive signals, while the axon and axon terminals are responsible for sending signals to other cells. It takes many neurons to make a nerve. Many nerves with long axons need a myelin sheath to help conduct the signal, kind of like the insulation around the wiring of your house. Spinal refers to the spine, and myelin refers to the bone marrow or the spinal cord, and neuro and nervi refer to the nerves. The electrical currents generated by neurons are transmitted to other neurons by utilizing special chemicals called neurotransmitters. These neurotransmitters are released into the space in between the neurons called the synapse or the synaptic cleft. Here you can see the neurotransmitters passing between the ends of two neurons. So let's review some key vocabulary you'll need to become familiar with regarding the nervous system. The combining forms cerebro and cerebri refer to the cerebrum, the largest part of the brain, which is divided into a left hemisphere and a right hemisphere. Cerebello refers to the cerebellum, a region of the brain involved in coordination. Crânio refers to the cranium, which is the superior aspect of the skull that houses and protects the brain itself. Encephalo refers to the brain. The brain is wrapped in a protective layer called the meninges, which is not shown here. And meningio both refer to the meninges. The cerebral spinal fluid, which is located in the ventricles and subarachnoid spaces, acts like a shock absorber for the brain. As mentioned before, the brain is made up of two large hemispheres called the cerebrum. The brain stem, which consists of the midbrain, the pons, and the medulla oblongata. Lastly, the cerebellum, which means little brain. It looks much like a tree here in sagittal section. Here are the lobes of the brain, frontal, which is most anterior, and then temporal lobes found most laterally on each side, the parietal lobe found most superior and bilateral. Lastly, the occipital lobe, which is most posterior. Notice Broca's and Wernicke's areas, which are important for speech, motor control, and understanding, respectively. Now let's understand what each lobe does primarily. The occipital lobe helps us understand what we see and interpret those images. The temporal lobe helps us hear and understand what we have heard. It also aids us in language comprehension and is most important with memory. The parietal lobes helps us with movement and sensations like pain, touch, and temperature. It also provides a sense of proprioception or the awareness of where your body parts are located. The frontal lobe is your personality, intelligence, and higher level of executive thinking. It is also involved in emotions and the expressions of speech. Like the brain, the spinal cord is wrapped in the meninges, which consists of the dura mater. This is the most superficial layer, and then the arachnoid, and lastly the pia mater, which is the deepest layer. The spinal cord lies in the vertebrae, which protect it. There is an anterior and posterior root that goes to and returns from the body. The enlarged area of the posterior root is a ganglion, which is a cluster of nerve cells. Ganglia refers to ganglion. Efferent neurons carry signals from the spinal cord to the muscles and glands of the body, while afferent neurons bring back information from receptors. The peripheral nervous system consists of all the nerves that come off the spine as well as the cranial nerves. They send signals to our muscles or glands and receive information back from our sensory receptors. Some of these nerves control voluntary movements like our motor neurons, and others stimulate or inhibit are involuntary functions like digestion or the heartbeat. The voluntary portion is called the somatic nervous system, while the involuntary is called the autonomic nervous system. The autonomic nervous system consists of the sympathetic nervous system and the parasympathetic nervous system. The sympathetic nervous system acts like our fight or flight. It helps us with situations like being chased by a bear. The parasympathetic nervous system is for times of calm, like digestion. The spinal cord ends at the caudoquina, which means horse's tail. Now let's look at the cranial nerves in more detail. Cranial nerve 1 is the olfactory nerve, and this is for our sense of smell. Cranial nerve 2 is the optic nerve, and this enables us to see the world all around us. 3 cranial nerves together, 3, 4, and 6, which are the oculomotor, trochlear, and abducens nerves respectively, all help us with movement of the eye. The trigeminal nerve, which is the cranial nerve 5, is used for facial sensations, whether bad or good. Cranial nerve 7 is the facial nerve, and this allows for facial movement and expression. Whoa, nice kitty. The vestibulocochlear nerve, which is cranial nerve 8, not only gives us the ability to hear, but also helps us with equilibrium or balance. Taste comes from the cranial nerves 7, 9, and 10, or the facial, glossopharyngeal, and vagus nerves, respectively. The vagus nerve also gives us autonomic control of such involuntary movements like our heartbeat and digestion. Cranial nerve 11 is the accessory nerve. It innervates the trapezius muscle that allows us to shrug our shoulders like we do not know the answer to a question on the next exam. Lastly, cranial nerve 12 is the hypoglossal nerve, and this allows for movement of the tongue. Those spinal nerves we showed you earlier innervate areas of the body close to where they are located. Nerves of the cervical spine, for example, innervate areas of the back of the head, neck, and diaphragm, along with brachial divisions from this area providing innervations for the arms and hands. Thoracic nerves providing innervations for areas of the chest and lungs. Lumbar nerves, which innervate areas of the abdomen and abdominal muscles. Sacral nerves to innervate muscles of the buttocks, thighs, and legs. Now for some nervous system pathology. Dementia is a loss of memory and cognitive function over time. The most common type of dementia is Alzheimer's dementia, which affect the elderly most often. Parkinson's disease is a lack of dopamine from the substantia nigra of the brain, causing a resting tremor or shaking of areas of the patient that are not being used. They also have a shuffling gait, or how they walk, and they watch their feet frequently while they walk, as shown here in this picture. Meningitis is the inflammation of the meninges, or the covering of the brain and spinal cord. This is usually from viruses, but young people can get bacterial infections that can be deadly. Neutral rigidity is neck stiffness. Photophobia is sensitivity to light. Phonophobia is sensitivity to noise. Encephalopathy or mental confusion can also happen in severe disease. Meningitis, along with some other diseases like normal pressure hydrocephalus, are diagnosed using lumbar puncture, which is using a large needle around and between the fourth and fifth lumbar vertebrae to obtain samples of the cerebrospinal fluid. Cerebrovascular accidents, also called CVAs and better known as strokes, come in two forms: thrombotic, which is caused by a clot or thrombus, or hemorrhagic, which is from bleeding, usually from a ruptured aneurysm, which is a weakness in an arterial wall causing ballooning of the artery. Both can cause loss of movement on one side of the body called hemiplegia. Since the brain is cross-wired, a stroke on the right side of the brain will affect the person's left side and vice versa. Cerebral palsy is a birth defect caused by lack of oxygen right before or during or immediately after birth. The injury causes spasticity of the muscles or uncontrolled tightness and contraction, which is the most common symptom. Ataxia or loss of muscle coordination and balance, and dyskinesia or involuntary movements is also seen. Bell's palsy is cranial nerve 7 or the facial nerve paralysis. It has many causes. Patients with this condition have a facial drooping on one side. Headaches are something we all can relate to, and the most common type is tension headache caused by muscle spasms in the face and temple areas. The most devastating headache is migraine headache, which comes from the brain meninges area and results in symptoms like nausea, vomiting, phonophobia, as well as photophobia. An aura or prodrome like visual halo may be experienced by patients before migraine begins. Epilepsy is the disorder that causes seizures, which is the symptom. There are several types and causes of epilepsy, and there are several types of seizures that can manifest from them. The, like migraine, which is a close relative, epileptics can have an aura or prodrome, which can warn them of a coming seizure. And after a seizure, they can experience a postictal period of confusion. EEGs or electroencephalograms can be used to help diagnose epilepsy and other neurological disorders using brain waves. Narcolepsy is a disease process of frequent fatigue along with daytime somnolence and falling asleep during inappropriate times. Spinal cord injuries are devastating for patients. If the injury is below the cervical spine, then they will usually end up with paraplegia, and if within the cervical spine, then they will have a degree of quadriplegia. This also depends on the type of injury as well as such as trauma or spinal strokes. When it comes to computerized tomography or CT, seen here on the left, and magnetic resonant imaging or MRI shown on the right, MRI gives us the best view of the brain and spinal cord, but CT can be used to rule out acute bleeds as it can be done faster. And now, due to popular demand, we bring you the special senses, which this textbook calls the sensory system. Here are your objectives. They're the same ones you have in Connect. Light enters the eye via the cornea, which is a transparent continuation of the sclera. It then is focused by the lens and projected onto the retina, and the information is transmitted by the optic nerve to the occipital lobe for interpretation. Blepharo refers to the eyelid. Oculo, ophthalmo, opto, and optico all refer to the eye. Conjunctivo refers to the conjunctiva. Coro, choreo, pupillo all refer to the pupil. Phaco and phaco refer to the lens. Retino refers to the retina. Corneo and corrado refer to the cornea. Cyclo refers to the ciliary body. Glauco means gray or silver. Iro, iridio, refer to the iris. Lastly, lacrimo refers to the tears. The olfactory nerve has receptors in the superior portion of the nasal cavity and project these through the cribriform plate of the ethmoid bone from the olfactory bulbs. Naso refers to the nose. Here we have the human ear. Sound enters the external auditory canal and stimulates the tympanic membrane, which in turn stimulates three auditory ossicles in the middle ear, which then stimulates the oval window and causes movement of inner ear fluid and then the hair cells and nerves in the cochlea. Audio, audito, aro, and auriculo all refer to hearing. Ossiculo refers to the ossicles. Mastoido refers to the mastoid process, which is not shown here, but is posterior and inferior to the ear and is part of the temporal bone. Cochleo refers to the cochlea. Salpingo refers to the tube, like the eustachian tubes that regulate pressure. Laringo and tympano refer to the tympanic membrane and the middle ear. Lastly, strumino refers to earwax. Always remember to swab on the outside. Touch is felt by the skin, and it can also be soft or hard. There are also pressure receptors as well as those for pain and temperature. Taste buds are located on the tongue, and depending on where they are at, may specialize in specific tastes like salty, sweet, or bitter. Smell and taste are related, and losing one or both of these can cause severe depression and malnutrition. Now to your favorite part, the pathology. Hyperopia is a condition in which an image of a distant object becomes focused behind the retina, making objects up close appear out of focus. Myopia is a condition in which the opposite of hyperopia, an image of a distant object becomes focused in front of the retina, making the distant objects appear out of focus. Glaucoma or ocular hypertension is increased pressure of the eyes. This can be measured by a device called a tonometer. If untreated, these patients can go blind. Astigmatism is a common and generally treatable imperfection of the curvature of the eye that causes blurred distance and near vision. Astigmatism occurs when either the front surface of the eye, called the cornea, or the lens inside the eye has mismatched curves. Strabismus is a disorder in which both eyes do not line up in the same direction. Therefore, they do not look at the same object at the same time. The most common form of strabismus is known as crossed eyes. Age-related macular degeneration, or AMD, is a disease that affects a person's central vision. AMD can result in severe loss of central vision, but people rarely go blind from it. Risk factors for AMD include being 50 and older, smoking, having high blood pressure, and eating a diet high in saturated fats. Otitis media is an infection behind the tympanic membrane and is very common in children. See the difference in the TM on the left, which is normal, and the right, which is infected. Otitis externa is also known as swimmer's ear, as swimmers frequently get this. It is an infection of the ear canal outside the tympanic membrane. This canal can be completely swollen and closed and have purulence coming out. Meniere's disease is a disorder of the inner ear that can lead to dizzy spells, known as vertigo, and hearing loss. In most cases, Meniere's disease affects only one ear. Meniere's disease can occur at any age, but it usually starts between young and middle-aged adulthood. This ends your week 4 lecture. See you again soon.